An estimated 26 million Americans have chronic kidney disease and another 20 million are at risk. It's hard to believe, but it's a disease you don't hear about a lot, and it's an epidemic that's only getting worse. So we wanted to get some advice from Dr. Rudy Garza. He's a board-certified nephrologist. And Dr. Garza, it's great to have you here today.
Good morning. Thanks for having me.
And you know, you don't hear a lot about kidney disease, but it really is a huge, huge problem.
It's a huge problem, and the symptoms can go undiagnosed. People don't feel anything. I often have my patients tell me, I don't think anything's wrong with my kidneys because I don't have any pain. But it's a silent disease, and it's one of those things that until it's very advanced, you don't feel symptoms or signs.
Now, what's the first step you should take if you notice something is wrong?
Well, if you think something's wrong, you should see a physician, and they should do some simple blood tests and also a urine test to see if you have kidney disease or if you're at risk for having kidney disease.
Now, you brought some examples here. You gave us, we have a good visual to kind of explain what's going on with your body.
Well, I first wanted to show the kidney because not a lot of people know what it looks like.
And where is it located?
It's in your back. It's actually very superficial, just a couple of inches into your back. You can reach the kidneys. This would not be the size of an actual kidney. This is not to scale, but this is just to show you.
Okay.
And it's fed with an artery and a vein, and it does a lot of work here in the outer part of the kidney. That's where all the action takes place. And I like to tell patients it's the filter of the body. It cleans the blood. I was going to ask you,
what is the primary purpose of the kidney?
Is to clean the blood and to rid the body of poisons and toxins.
So is it kind of similar to what the liver does?
In a different way. They're both different types of filters.
Now, you were also explaining the protein content in your urine is a sure sign as well.
Well, you're not supposed to have protein in your urine. Your body is supposed to, your kidneys are supposed to hold on to protein and not allow it to pass through to the urine. So one of the earliest signs, and very silent, is protein in the urine. So I tell people, because most people can relate to that, they've made spaghetti at some point in their life.
Yes.
So if you cook spaghetti, you then pour it in a bowl that has holes in it, a colander or a strainer like this, and the holes are small enough that the spaghetti should stay behind and the water should pass through down the drain. It's the same way in your kidney. Every beat of your heart takes blood to your kidneys, and your kidneys should hold on to protein. If there's protein that is showing up in your urine, it's because there are holes in your strainer or your colander, and so spaghetti is spilling down the drain or protein is appearing in the urine.
Okay.
And that can show up on a simple urine test.
Now, is there any way, is kidney disease, is it a hereditary thing, or is it something we can prevent?
There are heritable forms of kidney disease, but the most common cause of kidney disease is diabetes and high blood pressure.
Okay.
So the best thing we can do is stay lean and mean and exercise frequently and have our blood pressure checked regularly.
And you say to get checked regularly for kidney disease, correct?
I think once a year as part of an annual physical, you should ask your doctor, how are my kidneys? How is my kidney function? Because it's one of those organs that we can tell from very simple blood tests and urine tests what the function of the kidney is.
So when you go in for a physical, is kidney testing not typically something they do without you asking them?
It's usually done, but I think to try to raise awareness, people should ask, how are my kidneys? How is my kidney function? And your doctor can give you a specific number, say 50% or 60%, so that you know exactly what your kidney function is.
Now, I read that there are 5 stages in kidney disease, and you were saying what stage is it that if you catch it early enough that it really can be controlled?
Well, the earlier you catch it, the better, because there's more that can be done. There are some very exciting advances in medications to help prevent the progression of kidney disease. Probably most people get it detected at stage 3. That's the largest category of patients.
Stage 3 is?
Stage 3.
Okay.
And so we catch most of the patients when they get to that stage. And obviously we want to keep them from going on to stage 4 or stage 5, which would involve dialysis or replacement of the kidney.
I was going to ask you, is there certain medications you take to help regulate it, or is it kind of one of those things you have to go to the extreme and get dialysis?
No. If you have diabetes, you should control your diabetes. If you have high blood pressure, you should aggressively control your blood pressure to help the kidneys from getting worse. Now,
what are stage 1 and 2? Would you notice any signs with stage 1 and 2?
Unfortunately, you wouldn't even notice any signs or symptoms often until you're just about ready for dialysis. This is why this is such a silent disease, and we're trying to raise awareness so that people get screened early before it's too late. Once you get to stage 4 or you need dialysis, it's too late to do anything to bring kidney function back.
And why do you think we're in a time period where kidney disease is getting worse?
Well, I think we're living longer, and so as we're living longer, more of us are developing different kinds of problems. We're not dying of heart disease anymore, or as much, and so kidney disease is starting to show up. Also, the prevalence of diabetes is just huge, and especially in San Antonio, and so that's another big player in kidney disease.
So really, it's a matter of checking your overall health and trying to stay healthy. in your daily life what you do now, so hopefully you won't have to face something like this.
Absolutely. We are all aware of cholesterol screening and checking our blood pressure, but we'd like people to know and ask their doctor, how are my kidneys doing?
Now, you guys have a great program going on, and you can get free kidney screenings. That is free. So there's really no excuse for anyone not to go have it done.
No, there isn't. We're trying to make this available.
Okay, well, San Antonio Kidney Disease Center Physicians Group, they have locations. You guys have locations all over.
We're everywhere.
We're everywhere. All right. Well, if you want a free screening, write this number down. It's 661-5622. Again, that is a free screening. You can just call, make an appointment, go get a checkup. It's Monday through Friday from 8 a.m. until 5 p.m. Of course, they have a website, sakdc.com. And thank you so much for this important information.
Thank you for
Hopefully,
having me.
people will take advantage of the free screening.
We hope so.
All right. Well, thank you very much. And our latest Mikasa House is